Hello, good evening to all the viewers who are watching live. যারা যারা আজকে এখানে আমাদের সঙ্গে আছো, those who are included with us today have joined us today to watch this CME, our 25th CME. So welcome you all, and we are going to start our today's CME, in which you will get there as per the last registration done. There we have two winners, which will be announced by our introducer himself, and they had been sent the StreamYard link for our backstage studio link. And so, without wasting any more time, let's just jump into the CME program.
Good evening, everybody. Good evening, sir.
Good evening.
We started long back last year during lockdown, and today we are completing the quarter century of live CME online. Sir, our president, Dr. Devnarayan Kalyani, sir, we started long back and we are proud to be on the 25th quarter century CME today.
Exactly.
It's only possible because of the enthusiasm shown by the alumnus of NIH as well as the viewers and other students, the medicos of homeopathy. All of them had shown interest, and obviously our studio backstage team, the IT team, they are working day and night to make it successful. And tonight we'll be presenting you one of the most sought for speaker across the homeopathic fraternity and across the globe. So to introduce and inaugurate tonight's CME with permission from Kalyani sir, I'll like to request Professor Abhijit Chatterjee, who was the former director of National Institute of Homeopathy and presently HOD of Department of Materia Medica, NIH. Over to you, Abhijit sir.
Good evening, everybody. We are here and listen from Dr. Bidyut Mukherjee that this is the quarter century of the alumni association in this CME program. It's a good one, and we know that it helps us to increase our knowledge. And regarding the different cases, we are searching and we are getting informations regarding the same case from the great speakers. And it's a great privilege for us that Dr. Bidyut Mukherjee is collecting very nice speakers on every CME program in the month. That means every month. Today's program is a lesser known drug. Lesser known drug. So actually homeopathy, we are having very less knowledge, no doubt of it. But apart from that, there are some drugs which we use rarely. Very rarely we use this drug. And I like to mention here that a symptom stands on four legs. That is, if we consider it as a table, there are four legs in a table. If you cut one leg, the table can stand. If you cut two legs, the table will tilt. If you cut three legs, table will not stand. So we have to find out in every case the four legs of a table. But nowadays, it happens to be that only one leg can keep a big dining table. A big dining table can be kept by a one leg. And that leg should be a bit mota. So, there are some symptoms in homeopathic drug where one symptom may be the guiding to the patient. Only one symptom may be the guiding to the patient. We can prescribe on the basis of the one symptom, which is very much important symptom of that particular drug. Example, you will get a lot from Dr. Sarkar very soon. So, rare drugs having fractional proof and mostly is a clinical proving, because utmost proving of these drugs not happened yet. So we can take it in our MD course. We can go through it and we can prove these drugs vigorously by our students to the provers. But it is not yet done. In many cases, some had happened, some not yet. So we can do this. Finally, I like to say there was a competition where many names were registered, and two names I like to mention here who got 30 marks answering 6 questions. Moinak Rudra Das from Bardhaman Homeopathy Medical College, and he is studying in 3rd BHMS. And another name is Dr. Smita Pillai, who is an alumnus of National Institute of Homeopathy. So they will join later after the session is over. Now I like to say Dr. Sarkar may start the program because everybody is waiting to listen you. Thank you.
Thank you, Dr. Chatterjee.
Thank you so much, Abhijit sir.
Thank you very much. One thing I cannot but to mention that Dr. Abhijit Chatterjee, Professor Abhijit Chatterjee, at that time he was director. He was the beginner of this CME program of Alumni Association. So you are greatly helped. Simply by verbally we requested that minister has asked to help NI in some way. Alumnus can alumnus do something for NI? Then we talked to minister that hardly we can increase the intellectual or academic level by interacting CMEs. He was highly glad and asked us to continue. So just before the statue of Hanuman on the road of NI, I requested Dr. Chatterjee, that time he was director Chatterjee, that sir, if you kindly allow us to start this CME. Immediately, without any writing, immediately he told, start immediately, I will help in every way. Since then, this CME is continuing, and we are very lucky that till today he is with us always. So whenever we call, he comes and encourages us. Really, many, many thanks, and we are really thankful, Professor Abhijit Chatterjee. Thank you, sir, for coming over here, and thanks to everybody for joining in this CME. Vidut, please continue.
Now, I'll request Orko to bring Sarkar sir on the digital screen. Good evening, sir. And also Sarkar sir's slide shows on the screen. Good evening, sir. Please unmute করে নিন. Sir, unmute.
Okay.
Yes, sir.
Now
stage is all yours, sir.
Okay. Every introduction has its own introduction. 25th CME program, it's not a matter of joke. At first, my best respect, best wishes, simultaneously blessings to my senior contemporaries and the junior alumni of the National Institute of Homeopathy. As a student, as an employee, as a teacher, we have lots of personalities, eminent personalities, from their experience, we have learned a lot. From our seniors, the best possible clinicians, they have helped us to learn the clinical application. Simultaneously, most of our complementary teachers or my friends, my colleagues, from their eminent learning process, from that I able to take something, and slowly I have gathered and try my level best to apply that knowledge in the clinical field, that is the treating the patient. And most probably that is the very clinically very difficult job. I think it is very easy to speak in front of the student, but in clinically, the application of the knowledge of materia medica, it is very difficult, very difficult. And for this reason, I think every eminent teacher, every eminent clinician, ultimately they create their own materia medica as per their understanding and the number of the patient or the type of the patient they handles. And I have seen the beautiful results from my contemporaries like Dr. Shamir Bhattacharya, Dr. H.Z. Khan, L.M. Khan, Dr. Ashok Dash, Dr. Robin Bormon, my best friend, one of my best friend, Dr. Devnarayan Kallani, and my brother come friend, Dr. Abhijit Chatterjee. So also the younger generation of the National Institute of Homeopathy, they are trying to take this beauty of the clinical aspect of our materia medica in our OPD, in our private practice. Now, every clinician has its own thought process, but definitely if we share our thought process, most probably we can enrich each other, as I have enriched by the contemporary, not only teachers, not only my friends, even from the younger students, from which I learned a lot. Because I believe that learning is a continuous process. As Dr. Abhijit Chatterjee has told very nicely, that a smaller medicine, but really which one is a smaller and which one is polycrest, which one is bigger medicine, it is very difficult. And more we handle the number of patients, more we realize that as if it is sulfur, as if it is pulsatilla, as if it is lycopodium. But sometimes, most probably due to various causes, this medicine acting partially, or sometimes it may need help of others. Just I am giving a good example from Master Henneman, that lycopodium in clinical field. So many ways we can think of lycopodium, but after lycopodium, sometimes Master Clark is telling that every 8th day, if we prescribe carbovase, it is helpful, or it will further activate the activity of the lycopodium. Very simple, but when to prescribe, that is the question. Like this helping thing, helping tendency of the medicine, even with the polycrest, sometimes it is badly needed. Like that, I think scenarios are changes, and society, education, economy, social thought process, everything is changing, and most probably this classical prescription is very difficult to find out in reality. Most probably the constitution is already altered. I am telling that what we are getting at the present moment may or may not be a altered constitution after taking everyday anti-thyroid medicine, multivitamin, anti-hypertensive medicine, anti-lipid profiles medicines. So many medicine a person is taking every day. And after that, it is very difficult to find out the perfect picture of any polycrest drug perfectly. If we get, it is fine. But most probably it is very difficult. So sometimes, and not only that, even the susceptibility of the medicine, most probably that is also modified due to this excessive application of this type of numerous drug at a time. It is very difficult. I am giving one example. And apparently for this reason, as if it is pulsatilla, but it is not pulsatilla. I am giving a very good example. A patient has come to us, weeping disposition. We can think that yes, weeping disposition, desire company, intolerance of fatty food, but mostly we know that pulsatilla has aggravation evening. But here patient is telling that aggravation morning. So this is the basic difference. Now patient is telling that during deglutition, I feel some sorts of foreign body sensation retrosternal, which very rarely we will get in pulsatilla symptomology. Not patient is absolutely thirstless. So as if pulsatilla, but along with that, this foreign body sensation during swallowing, especially during solid food swallowing, and symptoms aggravates after eating, during eating, then most probably that part is not covering with the pulsatilla. So all the symptoms are pulsatilla. Rather, if we add that pulsatilla plus this something which is not covering by pulsatilla, but if we go through the materia medica properly, then you will get the medicine is cajiputam, and it is one of the very good medicine for this esophageal spasm or stricture esophagus or pseudo stricture. They are telling so many ways, but what I am telling that apparently pulsatilla, but it is not pulsatilla. But if we know that pulsatilla plus something, this local pathology which is not covered by our pulsatilla, most probably this medicine will do a miracle. And if we go through Allen's bigger book, that is the repertorial portion, or the 10th, after 10th, 11th and 12th, there you will see that during swallowing solid food, aggravation, after eating aggravation, the only medicine you will get this medicine, juniper, this cajiputam. So by this way, more we handle different types of patient, more we will get that value of the smaller medicine or what we are not using, due to, as Dr. Chatterjee has told, that it is a ocean and knowledge, it is very difficult to get the knowledge properly. I am giving another example. A patient has come to us, a child, mother is complaining that is learning disorder. I am telling, remember the child very, very difficult and extremely unattentive. Remember, extremely unattentive and not remember anything. And desire, longing for sour food like sepia, aversion to meat and bread, bitter taste in mouth, always drowsiness, extreme drowsiness. Remember, a child, extreme drowsiness, desire to lie down, desire sour food, aversion to meat, and whenever we are asking more, then what we are getting? The peculiar symptoms, inability, the mother is telling that whatever subject he is going through, reads without being able to appreciate the ideas of the subject. Reading, cannot remember, cannot understand. With something sepia, something sulfur, what I am telling, this medicine at 5 AM aggravation diarrhea, extreme flatulence and apathy, recurrent apathy. And if you get the history, that history of hepatitis, history of jaundice, chronic malaria, and in Allen's keynote, in Boric Materia Medica, very nicely it is written, liver symptom with eye problem and vesicular eruption with chronic liver diseases. Doctors, vesicular eruption with chronic liver diseases. So liver disease, vesicular eruption, chronic vesicular eruption, and this eyeball. Nowadays, a lot of children at the present moment is suffering from these eye diseases. Make these 3 or 4 with sleepiness, drowsiness, mostly during morning, and the name of the medicine is Cornus sarcinata. Cornus sarcinata. Doctor, this apathy, recurrent apathy, generally we are prescribing lots of medicine like borax, natramur, caliclor, sanicula, like this, but it is one of the neglected medicine, and more mental symptoms you will get, that thuja-like symptoms, unwilling to move, and Barita-like mentality, extremely mental dwarfness with liver problem. Let us think this medicine, and it is a gem for the learning problem of the children if we apply. I prescribe this medicine very frequently. Now, very small medicine, but it is really helpful. At least still remember, I think last 1 year I am applying this medicine. A girl, 9-month or 10-month old, fell down from the cot, got the head injury, and since then unable to see, not only really total blindness. Remember, Farrington has told very nicely that this is medicine is combination of ruta and belladonna. This is a combination of symphytum and belladonna, because that is a very good medicine for eye injury. Mostly in eye injury, direct eye injury, generally we prescribe ruta, symphytum. These are the 2 medicines. Coccus cacti, we know that some foreign body sensation under the eyelid, this is there. But remember, in our Materia Medica, that is in repertory portion, or in Clark Materia Medica, this medicine, if you go through, vision dim after blow in the head. That's only medicine, and the medicine is ammoniacum gummi. Dear doctors, it is really a gem. Last 1 year, we are keeping lots of CT scan and the CT scan and other investigation of the eye, that how the pathology is gradually, it is improving with this ammoniacum gummi. So this is not only this ammoniacum gummi, that is another. This is another scope for this chronic bronchitis of the old persons when enteric fails. But at least head injury, let us think that head injury leading to eye problem, head injury leading to psychological problem or the mental dwarfism natron self. Like this, head injury leading to the dim vision, it is very small medicine, but it is really a gem to a homeopath, those who are handling this type of cases. Now, I am not telling that it is a very small medicine, because to me, I think it is really, I was shocked or astonished by the result after applying this medicine. I think Dr. Kollani already seen this case from my side. What I am telling, a lady of 23-24 years old, pregnant, after third month, that is after crossing the first trimester, she went for CT scan of the abdomen, getting unconscious, transferred to the Arjikar hospital, and detected metastasis, multiple metastasis to the brain of unknown primary origin with pregnancy. Orko, can you show the first slide? Can you share?
Sir, please hold.
That is the
case is sharing.
The 4 slides are there of the brain. The first slide, multiple metastasis.
Hello.
Hello. If you want to say.
হ্যালো
অর্ঘ
স্যার বলছি যে এই কেসটা একটু পরে বলুন, আমি ওটাতেই কাজ চলছে, আমি একটু পরে দেখাচ্ছি।
আচ্ছা ঠিক আছে। Now what happened? So number 1, multiple metastasis pregnancy. What to do? They cannot give any chemotherapy because child will die. And metastasis condition, what to do? And primary lesion unknown. Patient was hospitalized for 18 days with semi-unconscious state with convulsion. And they told nothing can be done. Let the mother die. We cannot do anything. Either mother will survive or child will survive. We don't know. And patient is from poor family. They directly came through ambulance to my residence, that is Thakurnagar. And some of you know that I have 4 beds there. They keep the patient on 1 bed. Very funny thing, my assistant told suddenly rushed to my clinic. Sir, don't go to that patient because patient is already died. Most probably they have come to you to take the death certificate. Okay, let us see. Yes. That was really nearly bad. I told I cannot touch this patient because she is already dead. They told, we know doctor that she is dead, but still I think there is a hope, you try it. Let us see. Just we are checking very nicely, go through that how the observation. We observe light, one eye reflection is little bit there and another is no reflection. Try to understand that what is the role of physical observation in materia medica. In which medicine at the terminal stage, one eyesight nearly lost and another it is little bit spasm or it is reflecting. So we keep on watching the patient, and little bit we are observing some movement of one leg and one hand. That is a very slow. So we started on the symptoms that in head problem, meningitis, encephalitis, one eye vision totally lost and another partially still there or a spasm of the eyelids and eyeball. We start the medicine. We have 10 m potency only, and we have give the 10 m potency every half an hour. Let us see. Then after that, every 2 hours for 2-3 days, and then the patient get consciousness. I am telling that potency and repetition, that depends something else. Don't ask this question. Later on we will do. But what's the result? After 3 days, patient is getting conscious. Later on, that's a history. After 2 months, we give an our
Viewers, please hold on as sir is facing some internet issues. So please hold on until then, until sir returns. Sir is facing some internet issues, so let's wait for him. And before that, please do make sure to ask your doubts. We will we will highlight your doubts as soon as the initial session completes, as we are going to have a Q&A session after which will be followed by other sessions. So please ask questions, whatever questions you have in mind. Until then, I am taking the host on screen to have some chit chats. Over to you.
ইন্টারনেট ইস্যু ফ্রম ঠাকুর বাবু। হ্যাঁ স্যার, আপনি বলুন, আমি সরকার স্যারের সাথে কথা বলে নিচ্ছি ততক্ষণ বাই দ্য টাইম।
আচ্ছা, I will tell you Dr. Sarkar's come up?
Sir, এসে গেছে।
That's all right. Okay.
Something problem, internet issue.
Internet issue.
Yes, sir. Yes, sir. Please carry on.
Okay. So, I think Orgo will show the 4 slides that after that the mother delivered a healthy baby, even with all thoughts badly positive, with the medicine it become negative, child is healthy, and last 3 years we are keeping MRI every year, and the brain is absolutely free from all metastatic complaint, no trace of metastasis. And name of the medicine is apocyinum. I'll be happy that if Orgo can show the 4 slides. Otherwise, I will continue something else.
Hello, Orgodar. Please, I am talking to Orgodar, sir.
হ্যালো স্যার, স্যার ওই স্লাইড গুলোই, ওটার মধ্যে ভিডিও গুলো দেখাতে একটু অসুবিধা হচ্ছে। আমি একটু পরে আপনাকে ওটা পুরোটা স্লাইডটাই আমি দেখিয়ে দেবো।
আচ্ছা, ঠিক আছে। Okay. আচ্ছা, now we are going to the next medicine. So whether apocyinum, generally we prescribe this medicine for dropsy. In EPIS, dropsy, thirstness, and apocyinum chilly, thirsty, dropsy. Generally, we know it, but if we go through the bigger books, that apocynem is one of the medicine, and I think in no materia medica till today I am able to find out the cured what is done by this medicine. I think it should be included in repertory for understanding that even this medicine is capable to handle metastatic brain. It is not a matter of joke, because this case I shown to different places, but nobody can explain how it can be happen, especially in case of metastatic stage. Our next medicine, I think definitely it is all documented cases. So I will request or go that it is documented, no question of belief or a story. Laryngeal carcinoma, like forget it, throat, huge swelling, unable to talk, that is vocal cord paralysis, and then ultimately, this is very interesting case, a case from very respectable and affluent family. They contact first to the oncologist who treated that is eminent players. I am telling that the person who gives 6 ball and sixers, the first sixers, 36 run. You know everybody, I am not mentioning his name. He was also suffering from that cancer. That oncologist, he wrote very nicely a good letter to the patient party, because he is very affluent and very important person of India. He wrote that, yes, as a doctor, I am advising you to operate, but as a person, I am telling, I think nothing you will get if you operate on him, on your father. Very nice. The funny thing, that throat symptoms, it is a peculiarity. When I'm taking the cases this way, this way, that way, this way, that way, and that whether better by cold drink, better by hot drink, whether deglutition solid is possible, liquid is possible. So nothing I'm getting which can give a proper direction for the selecting a medicine. All on a sudden, that is person's wife told very nicely, Dr. Sarkar, last few days, what we are observing, that my husband cannot able to drink any liquid. Solid forget. And whenever trying to drink any water, just it is coming through the nose. But any liquid, any fruit juice, barley water, he can swallow very nicely. So that hits me, that is it not peculiar? Solid forget, because that is something else, but cannot drink water. But liquid, that is any mixed with fruit juice, apple juice, or anything little bit thicker than water, he can drink perfectly. That is one. And another, that it is taking this whatever liquid, it is coming through the nose, especially water. These two, I get the main symptoms, and after that this medicine has a special affinity for the laryngeal growth. Okay, so medicine I prescribed, Epilobium palustre. You can go through Allen's encyclopedia for better understanding, because in body nothing is written, especially diarrhea of the typhoid. So on that ground, just this throat malignancy, ultimately it ruptured through the throat, that is direct homeopathic tracheostomy. All photo we have hopefully Orgo will able to show you. Then ultimately with this medicine, slowly up to 1 m potency, these ulcers totally healed up. So I don't know that smalls are small or not. Because everything that depends on the case taking, understanding, and application. And more we apply the knowledge, because we know that our Allen's Allen's encyclopedia, that is full of proving symptoms. But herring guiding symptoms or Boric or Allen's, mostly these are the clinically verified symptoms. And for this reason, we have to think that what symptoms we are taking from clinical aspect, from theoretical aspect, from toxicological aspect. But remember that everything depends on in which way we are using, and verification only depends on, I am telling, verification only depends on your trial. Our next medicine, what should I say? That medicine very frequently are using but very rarely we are thinking that that can be applied in this way. Doctor, that is I am telling that rare application of common medicine. Why I am telling that Dr. Obhijit Chatterjee is here, Dr. Devnath Kallan is here, eminent teachers, eminent clinician. In Allen's keynote, it is written very nicely that child cries before urination. So, Saxapadilla, Borax, Lycopodium, these are the 3 medicine. But simultaneously, but nowhere in Allen's keynote or Boric it is written that child cries before stool. Doctor, child cries before and during stool. If we take from repertory, I think we will get the only medicine we will cover. Those who have now repertory on online or your instrument repertory, the only medicine will cover Rastax. So I think, as Dr. Chatterjee has told repeatedly, that it is a ocean. Then it is very difficult to understand or to apply the single medicine from every corner. It is next to impossible. Why I am telling that whether it is a small application or big application or a smaller application or a smaller medicine, it is nobody knows. Nobody. Like this, I still remember. I am deviating from my thought process little bit, because this is one thing, and if we go through the Boric's Materia Medica, there you will see very frequently about the inflammatory lesion near rectum, Rastax. Doctor, most of the time when some boil, fistula or abscess is going to develop, repeatedly we have verified very high potency of Rastax acts quicker than antibiotic. Within 24 hours, everything, it disappears like anything. And I think Orgo will not, I don't know whether he can able to show, because all document, rather than document that, let us see that what is my personal view regarding this Rastax. Rastax is another medicine, very only medicine you will see in repertory, that still I remember, some of you know that my village rail station is there, and just a very old budi, nearly 60, 65 years old, suddenly came to my clinic and just asking, rather you can say begging for medicine. Doctor, what unusual symptom is going on? This time I am developing bleeding part vagina. Very unusual. So mostly I'm thinking that it may be a case of malignancy or not. And I just give, I'm thinking that it may be a case of this and that. No. I am not suffering from that. What happened, you know, that I get down from the railway, but not from the platform side, opposite side, because I was I had no ticket. For this reason I jump, and since then bleeding vagina comes, but it is very peculiar. Baba, only অমাবস্যাতে হচ্ছে বাবা, মাসে একবার করে অমাবস্যা হলেই last 6 months I am suffering from this. অমাবস্যা হলে bleeding per vagina. So অমাবস্যা, new moon. So we are thinking alumina, causticum, silicea, calcarea curve like this way, and definitely, honestly, poor fellow. I am also not very much critical to prescribe the medicine, give this medicine, give Belispa, arnica like this, that. Then I, on a sudden, when it is not working for 2-3 months, then I open menorrhagia, bleeding, abnormal bleeding, vagina, new moon. The only medicine is Rastrux. And I prescribe Rastrux, and then the thought that jumping, that is muscle stress, whatever it is, in so many ways, Rastrux pathology is there. And since then, I utilize that every symptoms is important. Every symptoms may be less important to somebody, but it may affect a perfect clinical response to particular situation if other symptoms corroborate. We have no specific, but we have a specific of a group of symptoms. Maybe it is your allied symptoms, maybe accompanying symptoms, maybe concomitant symptoms, maybe peculiar modality. So in which way we can describe, but we have to know our materia medica in various ways. So let us discuss in this way so many medicines. Now I am giving a good help from what I have collected from my different materia medica, a very small medicine we are prescribing as cardiac tonic. The name of the medicine is Cratigas. But in no medicine, especially in the what it is written, that it is juvenile diabetes, nothing is there. But if we know from the different books, especially the clinical portion, then you will get, before prescribing Cratigas occidentalis, please ask that how far you can digest meat. Because if we know the application of Cratigas apart from the medicine, the England cooks, they apply this Cratigas.
প্রেগন্যান্সি উইথ ব্রেন টিউমার কেস রেডি আছে বললে আমি
আমি এটা বলে নিই, আমি এটা বলার পরে তারপর তুমি দেখাও, ঠিক আছে? এটা আমি শেষ করি এই মেডিসিনটা। So apply this, that intolerance of meat intolerance or meat indigestion, that is one of the keynote indication of the Cratigas occidentalis. And another thing, very nicely written, I'm slowly reading from the quoting, in a fatty tissue of palm near wrist are red, press it with a finger, try it will followed by a blanching. If it persists for a longer period with dryness of the back of hand and wrist, is the keynote indication of the Cratigas occidentalis. Again I am telling, if a fatty tissue of palm near wrist are red, press it with a finger, it will be followed by blanching. If it persists for a longer period with dryness of back of the hands and wrist is keynote indication. And nearly in some attention deficit children you will get they cannot focus, they cannot sit down, they cannot read, always restless, irritable and nervous, but press the palm near the wrist and blanching is persist for a longer period, prescribe this medicine and see the result. Doctor, so this is the expansion of materia medica by the clinical part. We are prescribing this medicine for heart, but simultaneously this may be one of the medicine for attention deficit disorder if we go through other materia medica. Now, I think Orgo will show our brain tumor case. Orgo, just to show the, I think, 4 consecutive MRI reports. Acha, you can see this patient. Yeah, that is the stage. The eyeball totally lost.
তারপরে ওই দিনই যেন হাঁটতে মারতে পারছিল না, মানে আলট্রাসাউন্ড করার পরে না আগে? পরে। কতক্ষণ পরে বাবা? ওই দিন থেকে আমার তো টাইফয়েড জ্বর ছিল। ও একলাই গেছিল। ফেরার সময় হেঁটে আসতে পারে। এখন কথাটা তো একদম বন্ধ। একদম। আর এই এক সাইড
It happens after 72 hours.
গায়ে হাত দিতেছ না, এত ব্যথা ছিল। সারা রাত দিনে ওর কোনো ঘুম নেই চলে। ঘুম দিতে বসে মাঝে মধ্যে হাত দিয়ে
কেমন আছিস? ভালো। You can recognize the pregnancy with metastasis to the lungs. Sorry, brain. Hot. সাপোর্ট লাগছে দেখা কাগজ বলো কি অসুবিধা কি হচ্ছে এখন নতুন কি হচ্ছে নতুন নেবার না number 1 number 2 totally clear. Toxoplasma positive, then toxoplasma negative. Although this April, I think the last we have done, I think I've sent today to you. Okay. And what about this epilobium case, Orgo?
এপিলোবিয়াম কেস তো স্যার দেখিয়েছি, সবাই দেখতে পেয়েছে। হ্যালো,
ও দেখেছো এপিলোবিয়াম দেখে দিয়েছো?
হ্যাঁ স্যার, এপিলোবিয়াম কেস দেখিয়ে দিয়েছি।
ওকে,
এটা ওকে স্যার। নেক্সট কেস,
নেক্সট কেস তোমার এই এটা তুমি দেখাও, আমি ক্যালেন্ডুলা বলবো। ওই মেলিগন্যান্ট গ্রানুলোমা, ওই মারির কেসটা দেখাতে পারবে? জায়ান্ট সেল মাড়িটা ফুলে গেছে, বা টাং সেলটা, টাঙের কেসটা আছে তোমার কাছে? না, ওটা কেস দেখাবে। কোনটা আছে তোমার কাছে রেডি? Otherwise, I will discuss another medicine.
রেডি স্যার, দেখে নিন।
Just what homeopathy can do with the smaller medicine. Just another photo. Last one. তুমি দুটো দিয়েছো?
স্যার কেস রেডি আছে, স্লাইডে অলরেডি দেওয়া। সিএ টাং,
সিএ টাং। আর তোমার গ্রানুলোমাটা, ওই যে মাড়িতে দেখো ব্লিডিং হচ্ছে, তোমাকে পাঠিয়েছি দেখো। This CA tongue, you can imagine that patient, what a serious condition it is, but how nicely it is under treatment, is still under treatment, but how nicely at the present moment patient is, the size is reducing, bleeding is reducing, blackening. That is the first condition. You can see just this one. Totally mouth is totally obstructed, and how slowly with our medicine, and the name of the medicine is Aram Triphylam. Doctor, we have to know materia medica from every corner. We have to know that how it can be done. It is not easy job. Every day if we practice, and understanding of materia medica, I am telling doctor, understanding of materia medica, that is more needed. That is more needed. Here I am giving another example, that understanding. Why I am telling understanding? At the present moment, just I am giving one example, that how we can enlarge our clinical practice. Nowadays, I think PCOD, it is very common. Rather, every girl is now taking bath with PCOD. Rather, normal menstruation is very abnormal at the present moment. And it is very difficult to handle also. Whatever the cause behind it, prolonged contraceptive pills, emotion, mental trauma, psychological atmosphere is changing, use of mobile, so many theories and thought processes are there. One thing, a patient develops menstruation. After that, she developed typhoid. Or, okay, this case I'll show. Before that, I'm telling that how quickly you can show this case. Okay, then later on, just let me finish this case. That all on a sudden menstruation ceased. No menstruation for 3 months, 4 months, 6 months, and patient is developing hostile behavior, weeping disposition, that is psychological upset, desire to be alone, desire to be isolated, like ignatia, like natramure. But no perfect picture of long shying, no perfect picture of other symptom complex of the natramure. But how all on a sudden menstruation ceased, menstruation ceased. After that, this type of mental symptoms is developing. And if we go through Allen's keynote, the helleborus is the medicine. Not only that, after typhoid and after the cessation, after the suppression of menstruation, if we think, then there is no menstruation. It is a gem. Think in that way, and most probably we will able to handle this type of cases, and rather we can expand our thought process of the application like this, that a smaller medicine, but a smaller application nowadays, it may be a broader aspect. In Allen's keynote, in Cocculus, most probably last line is there, that when fever tends to be sneaking, and remember, is it not pyrexia of unknown origin? We have lot of medicine, time modality, that is natramur, arsenic, lycopodium, or mental trauma, ignatia. So many ways we can think of fever. But remember, nowadays, lots of anxiety. One family member or one son, one daughter, parents are staying alone, sons or daughters are staying alone, like this way. Still, I remember a fever of nearly 3 months, resistance to antibiotics and others. When I am asking the question, that mother make phone call to the daughter who is supposed to come earlier, and she made 3 times phone call to daughter in front of me, and I prescribe this Cocculus indica. So mental aspect, and remember that how the fever symptom is corroborating. And Allen has wrote how many years ago that when fever is tends to the sneaking, that is complicated when hiding. Remember, doctors, understanding of materia medica and reading materia medica, more will practice, more will realize the inner meaning of this small word of our materia medica. Now let us see, again I am going to that how a small cases, how a small medicine can handle the our acute conditions. When I go through that Facebooks or the chatting of these NIS fellows, alumni fellows, I learned so many things. I am not telling what I am learning, but let us see whether really homeopathy can do any acute condition or not. Let us see a person all on a sudden, after operation, plastic surgery, cancer case, come to us, all on a sudden what happens, you see. You have heard eye bleeding. Now you see what eye bleeding is. Okay, so let us discuss this case in short. What you have observed that bleeding. So initially, that even after pressing, if you observe that no pain and bleeding, fresh blood, we started with millifolium 1m. And later on, after I think 2 weeks, now he is taking, you can see that watery discharge, offensive discharge, chilliness, we have prescribed Silicea, that is something else. But dear doctors, especially the, I know lot of beautiful practitioners are there, those who are observing. Mostly, what is needed in homeopathic world, that is courage. I am not telling fool's courage. You can say, we should not take this type of cases, that type of cases. Dear doctors, honestly, I am practicing in village, remote village. So I get this type of cases very frequently. But patients are coming from every status of the family to my villages because acute conditions, the tackling of acute condition, it is an art, little bit boldness and applicable knowledge of some small or big medicine, whatever it is. That is acute part, acute lycopodium, acute thuja, that is needed. Acute Silicea, that is needed, but we are not practicing. We are always thinking that big symptom complex, but sometimes it is needed, the acute totality is needed, and if you more you handle, more you get the confidence from the patient. I am telling, more you get this type of confidence of the patient. Honestly, I have lots of failure in my life, especially you know that I am handling every day 10, 15, 20, 30 cancer cases a day. It is not a joke. 3, 4, 6 ambulance is coming to my villages. They are staying, they are ordering. But from that knowledge, I am telling that really homeopathic students or the doctors is lacking the courage, the self-belief we are lacking. Whatever the cause behind it, I am not telling, I am not going into details. But if we reinforce that thought process that we also can do, that is the main need of the day. So this type of cases anybody can handle, provided you have the application of the knowledge of your thought process. Pages after pages, Allen or Boric, if we go through, it is not the matter, but how far or how much we are applying in reality, that is most important than the delivering lecture or quoted pages after pages from Allen or Boric. Now, another case, অর্ক ওই দাঁতের কেসটা কি আছে তোমার? that giant cell glioma, দেখো মাড়ির ইনফেকশন থেকে ব্লিডিং হচ্ছে। Hello. Okay. In the meantime, let us discuss another case, another medicine. That how we can enrich our thought process. It may be very small use, but we can extend in another way. Let me quote from Allen's Encyclopedia. A malarial feature is marked and valuable, and in this respect, it can be compared with gelsemium. So dullness, dizziness, drowsiness of gelsemium. A malarial feature is marked and valuable, and in this respect, it is to be compared with gelsemium, T.F. Allen. Now, next, let us go through the writings of Borland. Great weight in anus. Doctor Maldatta khub bhari hoye ache. Desire to pass a quantity, but nothing comes. Rectum feels heavy. Pressing. Okay. Let me finish this. And now let us go through the writings. If a child is incapable to do anything as long as someone is looking at them, he gets up at night and then able to read, write as long as shielded from the gaze of others. So when mother or father or the friend circles, they are watching what you are doing, the child become incapable, unable to read, unable to write. And mostly he wake up during night when parents are not there. He wrote, he does his reading, writing, everything in a perfect way. So this is the expansion of our thought process. I am telling the name of the medicine is cactus. How long we are prescribing cactus in malaria? How long we are thinking that encasing sensation, as if I am encased. So parents, father, mother, they are surrounding me. So I can't do anything. I can't do reading. I can't write. So this is the psychological aspect, and we can expand our thought process along with that rubric. Borland, if you go through the great weight in anus, desire to pass a quantity, but nothing comes. So that is cactus. By this way, we can enrich our materia medica application also. Now, let us discuss a case. Next. You show initial. Let us see. You can observe that how big the size is. The gum, no, that case later on. Let us see that how nicely, slowly, the bleeding, ulceration, everything is gradually disappearing or minimizing. Like you can see the last one. Now, how it is possible? They told, they asked to deposit 3,50,000 rupees to this patient. They have to remove everything, upper jaw, and the plastic surgery is needed, but they asked that we can try, but there is every possibility of the recurrence. Now, here is the beauty of the concomitant symptom. When I am taking the case very nicely, from various angles, we can discuss this case. It is a psychotic, because or psychosyphilitic, whatever it is. Whenever I am taking the case, rainy weather aggravation, sunny weather aggravation, winter aggravation, that is generalities, cannot tolerate rainy weather. That I get. Then any other complaint you have, I cannot take food due to my teeth are not problem. So many, I cannot eat properly, I cannot chew properly, whatever it is. Then the lady is telling very nicely. But a very funny thing, I am developing acidity, heartburn, flatulence, dyspepsia. Doctor, whenever I develop, before meal or after meal, I develop horripulion. My all hairs gets erect. Chulgulo, body chulgulo sab khara hoye jacche. Then and then we prescribe calendula 10m. You know that calendula is one of the antipsychotic medicine. And if we go through the Allen's keynote, idiopathic neuroma, Allen's keynote, idiopathic or traumatic neuroma. Not only, but more it is written in Boric Materia Medica, where it is written horripulion with acidity, heartburn, flatulence, dyspepsia. Not only that, this patient has so many symptoms which we are not using. During cough, pain in inguinal ring. It is a very good concomitant that even we can avoid the inguinal hernia with this medicine. Not only that, this medicine works on cervix. So many ways, but how with this small medicine, because most of the time we know that calendula basically it is a medicine for external application mostly, and mostly these thought processes come from Kant's idea or Kant's writings. But we should be thankful to the other homeopathy doctors, those who have applied calendula in different way, even in war situation. Some of you know that so many homeopaths works under totally in advanced battlefield with the homeopathic kits during First World War, and very few homeopathic students knew that Robert, who was famous for this philosophy, his repertory, his rheumatism writings, but he achieved the colonelship from the British government due to his achievement in the First World War. And so many questions will come, but before answering that question, I have one question to the audience, that during First World War, which medicine homeopathy doctors apply due to the gunshot injury on the lungs and gunshot injury on the stomach? Try to find out from Materia Medica or repertory. Then I will tell that from which book it is written. In Herring's writings, it is there. Next, our next medicine . Okay. Now, another small medicine, especially those who are very much interested to become skin specialist, I am telling, for them it is a gem, especially Douglas skin disease. If you go through, then you will get, but remember from Boric Materia Medica, faulty bile secretion, too much constipation, history of jaundice, history of liver involvement, and along with that, desire to be alone like natramure, do not want to do anything but eat and sleep, cannot think of concentrating mind upon subject, feel dull and cannot remember anything. And in very peculiar clinical observation, in dropsy of the chest, there are red spots on the skin as if flea bites. Dropsy of the chest with red spots on the skin looking very much like flea bites. And the very funny thing, this medicine, most of the homeopathy doctors are telling that occipital headache with liver involvement, history of jaundice, history of hepatitis, history of amoebic hepatitis, but that is the main symptoms, occipital headache, and mostly it ameliorates after rising, and it has peculiar symptoms, that pain under sternum before the onset of the coryza. And remember, this liver involvement, occipital headache, with chronic eczema of hands, one attack hardly subsiding before a fresh crop made its appearance, often passing from simple to impetiginous variety. Arms scratching, itching on thigh, itching on hips, itching on necks, itching on vagina, itching on spots after scratching, burning sensation, and moist perspiration on the itching area. Dear doctors, if you get this symptom complex, prescribe Juglans cineraria. Juglans cineraria, it's a gem. Those who will prescribe or who will be master of skin diseases. Juglans cineraria, liver involvement, constipation with skin diseases, with occipital headache. Now, very small medicine, doctor, coughing. Nowadays, so many medicines we are going through internet due to this COVID, this and that. But very small. We are small doctors, a small thinking, and a small medicine. I am telling from the Materia Medica. Extremely useful in incessant spasmodic cough like Cupra metallicum, with great irritation of the larynx. The cough threatens to burst the chest, is associated with sense of suffocation, and is followed by copious expectoration. This is really a gem for insomnia when it is impossible to get the sleep. There is coldness of the extremities. Dry swallowing cough, the chief action is organ of the respiration, dropsy of the chest, difficult breathing with stitches like bryonia, desire more air, frequent desire to take a deep breath. The name of the medicine is Lactuca verosa. Lactuca verosa, doctor, especially in coughing, no tubercular history of Drosera, and with insomnia, persistent insomnia, prescribe this medicine and see the result. Now, I think so many medicines they are in our practice. So many doctors are practicing a smaller medicine because the area changes, disease pattern changes, and the efficacy of the medicine also, I think, it varies. Now, two medicine. Doctor, so many times at the present moment, how scenario changes and medicine we can think of. Nowadays, so many people, they does not believe in God. Maybe Muslim, maybe Hindu, maybe Christian, because it happens in my life. What happens? A patient came, doctor, you are taking this picture, this God and Goddess in your clinic, this and that. I have no belief in God. Okay. This depth of the symptom, how patient is narrating, whether you are able to find out this symptom or spontaneously patient is telling. If patient is telling spontaneously, I think that has more value. Cut off from the spiritual world. I cannot believe. I don't pray. Now, what is written in our Materia Medica? In thin, dry palate persons with indigestion and flatulence, but with poor peripheral circulation. So, lean, thin like phosphorus, Nux vomica, sickle cord, poor peripheral circulation, cold and purple extremities, excessive craving for tobacco and alcohol. So tobacco, alcohol, we have nux vomica with ineffectual urging, irritability, and here does opposite. How to differentiate? No, I never believe, doctor. Why? Why you are going through Gita or Bhagavad or Mahavana, this or Allah? I believe it. If you get this, the mental aspect, and definitely the name of the medicine is Angelica, one of the best medicine which can abort the may control the alcoholic habit. But remember this, in body, it very nicely it is written how it acts on liver, spleen and others like our queer caste. But if you get this type of mental aspect, you are sure that it is really homeopathic, because it touches the mental aspect and physical aspect and the organ affinity. Like this, very small medicine I am telling, how to understand basic medicine, a small medicine, that is the art portion. You have to search from different writings, the origin, how it comes. Generally, we prescribe, doctor, have you any appetizer? For child or myself or whatever it is. Generally, we prescribe this medicine as appetizer, gentiana lutea. But have you ever tried gentiana in other words? Suppose a patient has come to you, patient is doing well with your aconite, belladonna, rastrax, lycopodium, whatever it is, but all on a sudden, I think slight deviation. Oh my goodness, it was 99, now it is 98. You got 3 times phone. Doctor, are you sure that your prescription is correct? Doctor, are you sure I'll be cured? Doctor, are you sure regarding your selection of medicine? Doctor, it happens in reality that patient is easily influenced by others. No backbone like silica. Doctor, what will happen to? Are you sure, doctor? I'll be cured. Then why did these symptoms develop? 3 times make a phone to you. Remember, acidity, heartburn, flatulence with this type of no confidence on himself, no confidence on doctor, no confidence on higher authority. But it is not silesia. Anxiety and silesia, anxiety of arsenic, anxiety of and lack of confidence of silica, both combine these two, and you will get the gentiana lutea prescribed in 30 or 200 potency of this. I am not telling hysterical patient, but definitely it is somehow it is hypochondriac patient. What will happen to me? Doctor, are you sure? Are you sure, doctor, that your medicine will work to me? Prescribe this medicine in this way. Then, because a smaller medicine in body, but we have to find out that different thought process from different books, collect, and then you will realize once you get the inner essence of the medicine from mental aspect and physical aspect, both with organ affinity, then you can create your own materia medica. More you handle this way, more you get your symptoms, which you can write down and which you can enrich our materia medica in near future. You have to add something. Most probably time will not permit. Now the last medicine, laughing in clinic. Various way that laughs. In our clinic, when patient answers in a smiling face, mostly belladonna is the answer. What's your name? My name is. What's your father's name? My father. What you are doing? I am doing like this. But remember, this smiling is very dangerous. In Kent's repertory, a smile so in answering, belladonna is there and oram is also there. Remember, oram, that is to hide the pain, sorrow, grief, hidden grief. This is another medicine rather competitive to our oram metallicum, that is anxious and worries internally, has forced cheerfulness externally, hides one's suffering. Whenever a patient has come to you, especially kidney problem, I am telling, liver problem or your gallbladder problem, even it may be malignancy or tumor, polycystic kidney, I'm telling, or nephritis, nephrotic syndrome. Why I'm telling this particular, these three, I'll tell later on, that hiding. Doctor, my mother, up to the age of 60, 63, 40, 45, never suffers from this disease. We have never spent a single paisa for his or her disease. Remember, these patients absorbs everything like a blotting paper. Never expresses highest possible absorbing power of the emotion like a staphysagria. But a staphysagria, internal turmoil, trembling. But she or he is always smiling, especially he or she, whatever is smiling, always smiling. My father or mother, we never know any time they had any quarrel with anybody. Remember, this hiding, how much absorbing capability this is? Doctor, whenever a cancer patient is coming to you with chemotherapy, without any adverse effect of chemotherapy, hairs are perfect, no falling of hair, no skin disease, no diarrhea, nothing else, tolerated this poison I am telling, poison of the society, poison of the mind, poison of the chemotherapy so nicely that here not a single hair is falling after chemotherapy. Think of this medicine, Egrimon eupatoria. It has 11 anti-cancerous alkaloids, ingredients in this medicine. And remember, patient is smiling, especially kidney. Why I am telling kidney, gallbladder and liver? Because in Chinese medicine, it is a common saying, emotion transmits through kidney, gallbladder and liver, especially kidney and liver, with a smiling face. No past history of anything, but answers a smiling. Doctor, how you develop this nephrotic syndrome or nephritis or albuminuria, proteinuria? Doctor, how I will explain? I don't know. Remember Egrimon. I think Dr. Vidyut and Dr. Kallani, most probably, I think time is too short. Most probably we have to answer something. I think it is better to stop here my lecture.
Sir, you can continue, sir. I think you will continue. The questions are there. We have requested our viewers to write the question after you complete. We'll give 2 minutes. In between, we'll make an appeal. The audience, live audience, will get 2 minutes time.
Okay.
To get jot down their question in the live chat box.
Okay.
Over to you, sir.
So it is already, I think, more than 1.5 hours past.
Yes, sir.
Because I think it will be good if we start question answer session. Any question to Dr.
Yeah, I think that is good. Then I think then we can discuss some other medicine also, no?
Right, sir.
Orgo, I think we have lot of slides. Can you show one?
Which one, sir?
This I think neuroendocrine tumor.
Prostate cancer.
Prostate cancer you can show. That is fine.
Okay, sir.
Over to you, sir. We are eager to learn.
I am also so.
Right, sir.
I am a very good student. I am a very good student.
We are all learning from each other, sir. আপনার থেকেই তো শিখছি। আপনি কল্যাণীতে জামান খান স্যার, এলএম খান স্যার, ভট্টাচার্য স্যার, অধিকারী স্যার. Orgo is arranging the slide. Apni sir, once you complete a part of the session, we'll have a 2 minutes interval. That time we'll make a appeal, and after that we'll come for the question answer session. Over to you, sir.
Okay, I think this is a very good case because this is a male case and we prescribe Bovista. Is it not, Orgo? Yeah, Bovishta
Also
1M.
snake carrying
I know, I
towards it.
remember. Yeah. You can show the picture, only the PET CT scan. Sorry, yeah. You can see the PSA 1563. And 2.82. You can imagine how even Bovishta can do. Very rarely we prescribe Bovishta. Choro, keep it. But what the photo is that your CT scan report, CT scans. That is the report, but the plates.
সিটি স্ক্যান রিপোর্ট ছিল না, অন্যটা ছিল, অন্য একটা প্রস্টেট ক্যান্সারে ছিল, ওটা স্যার ব্রেন সিএ।
Okay, we have it anyhow, but you see that how nicely that metastasis is disappeared. Doctor, it is not a matter of joke, but here we took but how nicely we have prescribed. The basic medicine was Bovishta initial starting point. Why I am telling, dreams that bitten by snakes. You know that in our repertory, bitten by snakes, we have two medicine. One is Bovishta and another is Century's Contortrix. Century's Contortrix, but Bovishta is a chilly patient and Century's Contortrix is a very hot patient. And this hot patient, but the person was chilly, and this is the application that how even this male and female, but even female medicine can be applied in males if other symptoms are corroborating. Generally, we know that Lilium tigrinum is a medicine for females, but if you go through Allen's, I think if you go very nicely in mental aspect, it is written for both sexes. Fear that I am suffering from very difficult organic diseases. I am not be able to cure. I am not cured. I still remember a case of Dr. M.M. Dotto in Calcutta Homeopathy Medical College. A lady of nearly, I think, 56 years old lady came with, I think, 20 or 25 ECG report. And she wrote very nicely. She told very nicely, doctor, no doctor is able to find out my disease. I am suffering from heart disease. And they are telling my ECG are normal. দেখো বাবা, MM দত্তকে বলছিলাম, আমার খুব মনে আছে এখনো, যে দেখো এটা কেন, আচ্ছা বাবা তুমি তো ওষুধ দিচ্ছ, আমি কি আরেকটা ECG করব? তখন MM দত্ত বলছে, হ্যাঁ মা তুমি অবশ্যই করবে, তবে আগে এই ওষুধটা খেয়ে নাও। এবং she and for her MM দত্ত prescribed Lilium tigrinum. But this organic disease, fear of organic diseases, I am suffering from organic disease, incurable organic disease. In Allen's it is written for both sexes. Please go through Allen's keynote very nicely. Okay, I think that is enough. We can discuss lots of smaller medicine pages after pages, because I use it very frequently, and even the allopathic medicine I am using in potentized form, that is also lesser known remedies. But I think one medicine, it is very difficult to learn in one lifespan. It is my idea, because every day I am learning, especially when my failures are there. I go through different books, different writings, and especially I am telling doctor, those who are really interested with open mind, you know that I think one of the best prescriber was Dr. Lippi. And if you go through the perfect case history, I think it took nearly 25 years to find out a medicine. I am telling. That patient was treated by different homeopathy doctors with lachesis. And Dr. Lippi prescribed for him lachesis 45 ml, 75 ml, like this way. And so many doctors, please go through. And ultimately, what happened, that skin was suppressed by ointment, and after that respiratory distress, this and that, everything comes out, and later on every symptoms of lachesis was there. And nearly every year, every second year, every third year, fourth year, the symptoms reappear during spring. So that is also lachesis. And after most probably time 25 or 26 years, continuous searching for the medicine, that lachesis is not working or partially working, they prescribe a medicine, Dr. Berry's, most probably. And he was the teacher of, Berry's was the teacher of Dr. Clark and others. I'm not sure whether Berry's or somebody, still I'm forgetting, that ultimately after 25 or 26 years untiring effort, that skin disease was cured permanently by rash vein. When lachesis failed of application of all sorts of lachesis, identification or the selection by the big most, I think, topmost stalwarts of that time. Ultimately, another stalwart prescribed lastly rash venenata. Please go through. So, clinical practice, it is difficult, it is easy. But really, what I know, that untiring zeal or effort, that we have to do something for the sufferings. Yes, failure is with everybody. We are not human, we are not God, we are human. But I think if we tried our level best, we can do so many things, and collectiveness, which is lacking in our homeopathic world, it is earnestly needed. I think if I criticize anybody, I think I am the best criticizer of myself, because a lot of failure with us. Until and unless I am perfect, I should not say that others are not fully perfect, because I am imperfect. Rather, we can think in such a way that collectively clinical materia medica, which is fading away from the homeopathic world, I am telling, really fading away. We are master in speaking, master in prescribing in dayas, but very rarely we are really effective or equivalent to the public demand. If today all homeopathic institutions closed by the government, nothing will happen except homeopathy doctors will cry. But even a Grameen hospital, if it closed, people's raising the slogan that why it is doing. Most probably we are responsible for that. Maybe there are so many questions, these and that, yes or no, but we should ask ourselves, is we really competent enough to handle the acute cases? If we ask ourselves, most probably then most probably we have to run a long road to get this answer. Most probably we are really internally, we are weak like lycopodium, and for this reason we always raising our voice. Sorry to say, I am not criticizing anybody, but most probably we have a lot of faults. We have to rectify ourselves and we have to be united. Thank you.
Thank you, sir, for such a great presentation and such sharing of enormous knowledge. Just we want to give you 2 minutes rest, and with permission of Kalyani sir, let's make an appeal to all the, in between these 2 minutes, all our live viewers, please write down your questions on the live chat again, and our backstage editor will highlight them. Before we go on to the question answer session, pardon me, I'll an appeal to all the alumni of National Institute of Homeopathy. Now we are running through pandemic across the globe, and during this pandemic, a lot of our alumnus are suffering in spite of best homeopathic and modern medicine treatment combined together or singularly. Lot of our alumni are now in ICU. Some are being treated at home quarantine, and a lot of them are in distress. I had given a appeal in our alumni 3 WhatsApp groups. We have altogether so far three courses in NIH since 1975. Kalyani sir, our president, is there. He is from third batch of DIP NIH. Myself from first batch of BHMS, and we had PG courses, MD. So all these courses combined together sum up to 2,000 plus alumni across the globe now. Some are placed at Canada, some at UK, US. Few of them are in UAE. Few are in Australia. Apart from, we have students directly from Russia, from Germany. We are having students, a lot of students in our alumni association who had already participated from Sri Lanka, from Nepal, from Bangladesh. Now, summing up all this 2,000 plus alumni across the globe, an appeal to all of you, please come forward. We have our bank account number in the description as well as in the groups, in the Telegram group also. And the alumnus who are in distress, individual alumnus who are in distress, need some sort of support from our total alumni. So summing up together, let's form a unity. And please, we request all the persons who are listening to this broadcast tonight and who will be listening in the future, please come forward and donate for the benevolent fund. We had lost recently our very talented alumnus, Dr. Sanjay Pandey, who was a professor in Nehru Homeopathic Medical College. We are going to help his family, whatever resources we have. We had few alumni in ICU in various places in our country. And also we are keeping in touch with our Sri Lankan and Nepal counterpart. By grace of God, they are all okay over there. Please come forward. Whatever amount you want to donate, please donate generously in the bank account of Alumni Association, PNB bank account, which is given in the description and which will be scrolled across the presentation. Now, don't think about the amount that I can pay this or I can pay that. There are people who can pay more than, who can pay 50,000, 10,000 or more than that. But there are people, I am really overwhelmed today morning when I got few messages from the alumni in distress from the ICU that they really need help. It brought tears to our eyes. And on seeing those appeal in the alumni group, immediately some student, not student, now alumni, who had just passed out, they immediately contributed 100 rupees, 200 rupees or something. So I thanked wholeheartedly to those people who immediately responded. The amount is not a big matter. The thing is our intention to respond to the situation. So again, every episode, Dr. Pralay Sharma, your beloved Pralay sir, used to appeal for this. Today, Pralay is really morosed and very sad with the things which is going on. So Pralay had requested me, Vidut, tonight you make the appeal to all the alumni so that they can come forward and donate generously so that we can at least give some sort of help. Those who are really in distress now. Thanks for your patient hearing for our appeal. Over to you, Kalyani sir. And I'll request Orko to bring up on the screen our inaugurated today, Professor Abhijit Chatterjee sir also, for the question answer session.
Something, please?
Yeah, please.
You grant me permission. Thank you. Before starting the question answer session, let me just inform all the viewers who have registered their registered yourself on that registration link. We cannot contact with Smita Pillai, so we are taking on our third winner, who is Dr. Pritha Mehra ma'am, and she is a medical officer and also an alumni of National Institute of Homeopathy. So this was only the few part I want to just quote, and after this the Q&A will start with Maina Krudra Das, our first winner. He will be on up first for asking question, and then Dr. Pritha Mehra. So this was what I wanted to just say. Now over to you, host.
Also, please bring on our sir today and Professor Abhijit Chatterjee. Over to you, Kalyani sir, for the next part.
All along he is with us, and he has expanded his ability, efficiency to abroad. One of the most successful alumni of NIH. It is all known to you, and in near future we expect that we'll learn many things from him. Really, we are grateful. And one thing Vidyut was appealing to all of you. Really, we want to make one bondage. This CME has inspired us to create a bondage between the alumni, not only to improve ourselves, to improve homeopathy. Dr. Sarkar has shown and inspired that documentation is an essential part of present scientific world. Documented statistics of documented cases are being wanted by the scientific world, and this is very, very, very essential for survivance of homeopathy. Unless you are able to produce statistics of documented evidences of cure, we have to fight. We have to go on fighting and fighting and shouting. So please, brothers and sisters, all of you, please be encouraged from Dr. Sarkar that whatever case you cures, keep documentation by blood test, by MRI, by USG or X-ray, whatever it is available. Bring it to us. Please come forward, present before us. Let us collect together and forward to higher authorities to prove that homeopathic system is an absolutely science and one of the most advanced nanotechnological therapeutic system of medicine in the world. Thank you very much to all the viewers and speakers, and especially Dr. Abhijit Chatterjee. Now, Dr. Chatterjee, please come forward to conclude and to add your experiences. Please.
Only one thing I like to say here, what a knowledge Dr. Sarkar has. We never thought of these sort of drugs in the cases what he has prescribed. It's nothing but the lack of our learning. Dr. Sarkar has showed us where and how we can apply this medicine, going through it properly in different books, not on the basis of our just imagination. Really, Dr. Sarkar is definitely our dada. Dada likes me, I know that, but he brought me different areas also. It's nothing but to say one thing, that we have to read Materia Medica as per the instruction of Dr. Sarkar. The different areas, then only we can be able to understand Materia Medica, the prescription of Materia Medica. Otherwise, it's not possible for us. Going through mere books will not give us the knowledge of Materia Medica really. So this path shows by Dr. Sarkar, means my dada. We have to follow that. Then only it will be possible to treat different types of cases. Thank you very much. Good night.
Thank you, sir. Please don't go away. As a part of the contest, the first winner, fastest finger first, Moina Krudru Das will come up on the screen to ask the first question. Pralay, you take the question from Mainak Rudra Das. He is a third year BHM student of Bardhaman Homeopathic Medical College and Hospital.
Good evening to all respected teachers and sirs. My doubt was about the case of the CA tongue of the aurum triphyllum, and I also request sir to compare between the nose symptoms of Sina and aurum triphylla. The itching and irritation of the nose is seen in both the drugs. So sir, please.
Thank you, Mainak. Thank you. Please be on the backstage, and over to you, Sarkar sir, to answer Mainak's question. Thank you, Mainak, for being in the show. Over to you, Sarkar sir.
Yeah. Okay, Mainak. This question, this tongue cancer, as you observe, that it is still under treatment. It is not fully recovered. Okay. Number one, because just I'm showing the ongoing cases, ongoing case. And number two, that any cancer cases, I'm telling that single medicine, if it is the virgin cases, different potencies of single cases, single medicine may cure a cancer case. What it is written, please go through. I'm mentioning that Dr. Grimar, the student of Kent, he wrote, he started this line with Naja chapter. But when the disease is complicated or it is appearing late to you, multiple medicine of different medicine is, multiple potency of different medicine is required to complete the cure. As I am telling that it is not yet fully cured, but it is, I am showing that how slowly that swelling is reducing. That does not necessarily mean it is cured. That is one question. And aram, I think aram itching and aram burning, it is more prominent in comparison with Sina. Sina mostly it is coming itching due to the one reflex. And Sina, mostly you will get a peculiar component and just opposite of your chamomilla. Chamomilla has hot perspiration over the face and head, and Sina has opposite, that is a cold perspiration. If you go through boric materia medica, today night you go through, and most probably this ulcerative stage of Sina, I think it will never occur in Sina stage. It will never occur. But rather, you know that it is kochu. So just to imagine that what kochu can do in your mouth, and with other symptoms also you will get. But I think Sina, it is totally, that is the reflex phenomena from the one, and it is totally local pathology, which is more important in aram triphyllum. And aram triphyllum, the burning sensation and itching persists even after hemorrhage, it is there. So I think from pathological point of view, the itching of Sina, it is more due to the reflex phenomena, and it is the pathological phenomena is more important in case of aurum triphyllum.
Okay, thank you, sir.
Thank you so much. Over to Pralay to call upon the next winner.
Okay, it was a very interesting and very overwhelming program today that we have been with Dr. Sarkar today, and it was very informative. And now I request the third winner, because we could not contact with Dr. Smita Pillai. She is abroad. So I'll request Orko to bring Dr. Pritha Mehra. She is in CCRH as a senior research officer. She is not a medical officer. She is posted in Central Council of Research in Homeopathy at Delhi as a research officer. She is a very learned person, in fact. I'll request Pritha to put her question in front of this webinar and to ask Dr. Sarkar sir.
Good evening, everyone. Thank you so much for giving me this opportunity, and I'm really grateful to all my teachers, all my seniors, because I have been learning from each one of you, and it's a overwhelming thing to be here again. Sir, my question to Sarkar sir is, sir, if you can say a few words about gallium metallicum in case of tongue cancer. And one more question is that about lactuca virosa, you said constant cough with persistent insomnia. But in Borrelia medica, the polarity of that aspect is also there, that there is deep and comatose sleep. So, sir, how to consider and how to understand that aspect?
I think, Pritha, you have already got your answer in your question, the question of polarity. Okay. So, I think Natramur has desire for salt, aversion for salt. Okay. So, some materia medica, with especially in cough, very rarely you will get the comatose condition. That is, you think in other pathological condition. Okay. So, a spasmodic cough with insomnia. This insomnia we can take in various ways, no? In lecithin insomnia, in cholesterol insomnia, even in this lactuca virosa, the polarity when it is a spasmodic cough with insomnia. Okay. And I think I'm not sure if I am. It is gallium met or gallium aperin, Pritha?
Sir, gallium met.
Then I have not used the gallium met, but I know that gallium aperin is a very good medicine for the tongue cancer. Gallium aperin, neurofibroma, multiple neurofibroma, and especially what is my experience that I am using tongue cancer with kidney involvement. Polycystic kidney or multiple cyst, especially if you go through different books like calendula, this is the medicine, the gallium aperin, which has lymphatic channel. It has a special affinity for the lymph nodes. And if you go through the botany also, this is the plant. It's basically weeds. So most of the time, the farmers or the gardeners, they cut this plant, burn this plant. The peculiarity of this gallium aperin is that it never reappears on the same places. When you cut it, when you burn it, then it will just under the soil, it will grow and grew in another place. So just like lymphatic metastasis. So my breast, it was operated, and after 1 month or 2 months or 1 year or 2 years, that lymphatic channel that is in ingroin region or other places, axillary region, it has appeared. Think of gallium aperin. And I have no idea regarding this gallium metallicum, but so far I know that gallium metallicum is the medicine, tongue cancer, kidney involvement or the lymphatic involvement.
Okay. Thank you, sir.
Okay. Thank
you, sir. Thank you. Thank you so much.
This gallium metallicum, is it from your Sultan's books or something else?
Sir, I was actually reading through Homeopath Firefly remedies. So gallium met, it is mentioned scrofulous affection of the tongue. It causes ulceration of the tissues. So, so I thought maybe
I have no idea because I have never used this medicine. From which book it is there? Materia medica source?
Sir, book is not mentioned. Actually, that software I was just reading. That
I am telling this software because maybe just to check it, because software has lots of, I am not telling anything, information which is not clinically verified. Not at all clinically verified. Okay. I know gallium aperin, but I don't know gallium metallicum. Okay.
Sir, aperin is also mentioned, but this was also there. So I just thought of asking you because I'm not getting it anywhere.
Just verify. Okay. Because basically at the present moment, what I am telling, don't take it otherwise. The most of the cancer reports in homeopathic world, we have to think twice, especially those who has written very recently, because in European country, homeopaths cannot treat cancer legally. They can help for the health issue. Remember.
Okay.
So if anything comes, we have to take it with a little bit salt.
Right, sir.
Thank you, Pritha, for bringing this question in this show. And I also would like to thank Sarkar sir for giving this wonderful answer in front of the viewer. Now handing over to Dr. Mukherjee.
Thank you, sir, Pritha and Pralay. Now we'll go for the Q&A session. Q&A session of the live viewers. There was a question from Hayati Lakhani, all for Dr. Sarkar. I'll request Orko to bring Abhijit sir also on the screen, Professor Abhijit Chatterjee. Insomnia with lots of dreams, which remedy should be given? Sir, অনেকগুলো কোয়েশ্চেন আছে, আপনি যেটা যেটা নেবেন সেটা একটু বলে দিচ্ছি। একটা প্রথমটা বলছি ইনসমনিয়া
অসম্ভব।
স্যার 6টা কোয়েশ্চেন আছে, টোটাল 6টা আছে।
হ্যাঁ, অভিজিৎ কোথায় গেল? হয়তো
আর নিচ্ছি না, 6টা কোয়েশ্চেন হচ্ছে ইনসমনিয়া উইথ লটস অফ ড্রিমস, হুইচ রেমেডি শুড বি গিভেন। এরপরে গৌতম ঘোষ দিয়েছে
প্রশ্ন করে শোনো, ইনসমনিয়া উইথ লট অফ ড্রিমস। হ্যাঁ, তো দেখো, the first medicine I will think for coffee. Lots of dreams, one after another. Okay, so many medicines are there, but what type of dreams? Anxious dreams, horror dreams, fearful dreams, change of dreams, same dreams, recurrent thought process. So I think more you have to clarify regarding these adjective of the dreams, what type of dreams or what type of the thought process. Okay, but definitely once after another, sleeplessness with different thought process, think of coffee or think of cocculus indica. These two medicines are very important. Okay, next.
Sir, next question is from Gautam Ghosh. Sir, please tell some medicine for melasma.
For whom? Melasma of what age?
Very difficult to say. For whom?
Age group, দেখো, melasma, plasma. So it is brownish spots especially.
Very difficult to say that if it is the case of melasma only, it's very difficult to describe.
Very difficult. But then also I'm telling this type of brownish color, maybe it is psychotic manifestation like Thuja, but if it is on the face especially, and especially after pregnancy, I am giving a good tips. Brownish discoloration, hyperpigmentation over the face after the childbirth. Generally it happens. Think of Crotalus horidas. Please open Kent's repertory. The only medicine, and if provided patient is hot, patient cannot tolerate tight clothing, that take I think other things, but only medicine that is Crotalus horidas. And for the younger girls with a strong history of cancer, carcinosin is one of the best medicine. It works very nicely. But another, what I am telling, depressed, smiling, but very much depressed due to this skin disorder, especially the girls of the puberty or the adolescence. I am telling a medicine, if patient always is smiling, as I told, like Aurum metallicum or Ignatia or Belladonna, plasma with a smiling face, very rarely you will get, but if you get, it is a gem, that is your potentilla, go through potentilla. Okay, that answer is finished. So many qualophyllum is one of the medicine, but use it. But most probably, if it is deep acting, then think of the strong family history is there. And another from the liver origin, as I told, it is one of the neglected medicine is, as I told, that is just now what I told, that is the cinerea, that is Juglans cinerea, one of the medicine. Go through another medicine, black pigmentation or the blackish pigmentation, think of your ichthyolum. And another good medicine is your skukumchak, if patient is very hot and dry skin. Okay, CPR, one of the medicine. But always take guided by symptoms. But most probably, if liver is involved, I think one of the neglected medicine is your juglans. Okay. Next.
Sir, next question from Umesh Vishwakarma. একটু অনেকটা বড় আছে. I found one symptoms in nitric acid, tracking of jaw with masticating, probably লিখতে চেয়েছে why masticating, and what is about these symptoms? In continuation, I found this in Allen's keynote and chronic disease. Can we prescribe on these symptoms or not, sir? This type of symptoms present in my friends, so that, sir, eager to know these symptoms reliability.
On single symptoms, I think it is not to prescribe. I am telling whatever the medicine I discuss my level based from mental aspect, modality, time modality, and concomitant. If you really willing to get only on this symptom, why not calcarea float? Why not causticum? So many medicines are mastication problem. Na TMJ joint is some problems are there. So I think on this basis we should not prescribe. But along with that, if patient has desire for fatty food, unmoved by apology, very chilly, and if we go through the Allen's keynote, that very rarely we prescribe nitric acid if patient is constipated. So that diarrhea is a common in nitric acid patient. So if we think in these 2-3 symptoms complex, then only we should prescribe nitric acid.
Thank you, sir. Next, Saurabh Goswami. Probably this has been answered already. What was the symptoms of CA tongue patient of aurum triphyllum?
I think I have already discussed.
Right, sir. Just Dr. Paula, burning sensation in the chest with pain in the whole right side of the body, especially lower abdomen and legs, ameliorated by pressure. Just a active question.
Burning sensation in the
chest with pain in the whole right side of the body, especially lower abdomen and legs, ameliorated by pressure.
I think I have to do computer, that is repertorization. I can't say on this ground.
Right, sir. Just question.
This is not the complete symptom also. This is not the complete symptom also.
No.
Right, sir. Sir, আপনার ফোকাসটা একটু নড়ে গেছে, মানে আলোটা মুখে আসছে না, ডার্ক হয়ে গেছে।
আলোটা ওর মুখে আসবে না কারণ লোড শেডিং হয়ে গেছে, স্যার।
আচ্ছা স্যার, last question. Sir, last question of the show tonight. Which books we go through to make a good prescriber? আর কোনো question নিচ্ছি না।
Yes, that book you have to write yourself.
Right, very right.
What I am telling, that you go through different books and try to make a picture in your mind of your own. Myself, Dr. Kallani or Dr. Abhijit Chatterjee, we simply can guide, but you have to prepare better on your own mathematics according to your capability of digestion, capability of understanding. And I am telling the materia medica understanding when I start practice or student nearly 50 years ago or 45 years ago, now materia medica understanding of the same line or same word, it is totally different. Every day you have to go through book and then only knowledge will come, and after the knowledge, through the application of knowledge, the wisdom or the realization will come. So it is a long process, and only go through the books and quoting and memorizing never will make you a good doctor. Practice yourself, then only you will see the beauty that your materia medica is the best materia medica.
Sir, just মানে forgot, আমি দুটো question opt করে বেরিয়ে গেছি. From Jahangir Molla, clear right renal cell carcinoma on the screen. আপনার স্ক্রিনে দিচ্ছে কোয়েশ্চেনটা, এটা দেখে নেন। আর লাস্ট একটা কোয়েশ্চেন আছে, আমি শুধু যিনি করেছেন HMCH সেমিনার তার পুরো নামটা জানি না। I am requesting HMCH seminar, please write your name, doctor or medico. He had asked, sir, what is your view about mucormycosis. এই দুটো লাস্ট কোয়েশ্চেন।
এই দুটো লাস্ট কোয়েশ্চেন, that is the renal cell carcinoma, metastasis to liver, right lung, or 6 to 8 years old, DM1, CAD, lean, thin, easily angry, hypersensitivity medicine. I think we need lots of other symptoms also, but definitely I think that right cell, whether it is already operated or not, that is one question. And most probably in these terminal cases, the what symptoms is at present, which is more painful or which is showing maximum modality, start with that medication. If it is liver metastasis, if it is lung metastasis, whether it is most probably right side, so even it may come even lycopodium with flatulence, dyspepsia or not. It may come so many medicines, but most probably the present symptom complex is the best guiding for a start as a starting point. Because this type of cases with homeopathy, definitely better result we can expect. Right lungs, then definitely liver. So right side is affected. Just I am giving a probable medicine. At least lycopodium we can think of with other symptoms corroborates. But I am not giving anything. But even also this renal cell carcinoma, again I am telling that nothing happened in the past history, but only suddenly it appears. Think of your egrimone with a strong family history of emotional trauma. Then another medicine, if with history of hemorrhagic nephropathy, the one very good medicine, your cyclophosphamide. So many medicine we can think, but at present, take the case history and definitely you will get better result. We have at least 3-4 renal cancer case living for more than 6, 7, 8, 9 years. We are not telling cure, but definitely symptomatic relief is possible.
And sir, the last question jeta bollam, your views about
Doctor, I think it is better not to answer because so many things is going on. Mucormycosis, because I think I better not to answer because a lot of confrontation, because so many few patients are there, and especially the we are thinking only for this small groups, small diseases. But before that, but still I am telling, because I have not treated any case, numbers are few, and even if you go through the internet, doctor, you will go through diverse opinion. Number one, most of the fungal infection is starting on the left side. It is painless, and go through other side, painful. Then, so whether it is painless or painful, I have no idea. Then black spots, soft palate, and sometimes it is written on the nose. Ulceration, falling of teeth, gingivitis. So many common symptoms are there, and I think in one way, until and unless we get all the modality, if it is pain, whether burning, stitching, stinging, if it is no pain, then that is also characteristic. Where pain should be there, we have group of medicine. That it is totally painless. That should be, I think, you know, that even stramonium or your opium. Then another is one-sided pain. And one-sided pain, then soft palate affection, eyeball affection, and so many medicines are there, including Spigelia, Sanguinaria, so many medicines. But bones, nose, antrum of the highmore, with neuralgia, when Spigelia and others fail, the first medicine is magnesium carbonicum. And magnesium carbonicum is only medicine where you will get tongue papilla bleeds easily even with touch, single touch causes bleeding. If it is hemorrhagic, I'm not telling because it is very difficult until and unless you handle the case. But another, if it is really black, then go through Kent's materia medica, Allen's materia medica, that mouth and rectum, these are the two prominent affecting zone of this medicine, and ulcer black spot. Ulcer base is black. The only medicine in our materia medica is muriatic acid. Then in another scope, fungus should be treated by fungus. It is fungus. So Sicalicor, if it is burning, cold application, then another thing. Then the question of lysis. All on a sudden, the lysis or the bony destructions develops. Maybe Kaliiod. Maybe perforation of the mouth due to ulcer. The single medicine in our repertory is Calicloricum. And another thing, that the fungus who is capable to lysis the bone, in our homeopathic materia medica, one fungus is there, Cordyceps sinensis. Cordyceps sinensis, lytic condition of the bones. So there are so many probabilities, and again I am telling, I have not handled the case, so I am not making any thing that this is a specific. I never believe in a specific, but a specific with 2-3 symptoms, it will guide us properly. Whatever it is black fungus or aspergillus or the white fungus or even your COVID-19 or 20 or 21. We are always guided by symptoms. Be happy with the basic principle. We have no specific, we have a specific with symptom complex. Okay?
Thank you, sir. Thank you for your valuable time. We had been enriched a lot with your views, with your teachings. We always want to be blessed by the seniors like you, Kalyani sir, and Khan sirs, Adhikari sir, Abhijit sir, and all. And I think tonight our viewers are also enriched with all of your experience. It has been an awesome discussion, and it's an August gathering. In fact, Abhijit sir, Kalyani sir, Sarkar sir, you can't imagine. I am going on with the studio views. Almost till now, the show has been live to 756 viewers. 756 viewers. That means doctors live, and it will go. Will be stored in the video format in our National Institute of Homeopathy Alumni channel, YouTube channel. And there are a lot of questions in the later stage, as sir is having a load shedding in his area. We are not taking further questions. We had requested our viewers to give you a question to tomorrow in the comment section once the video gets uploaded normally on the YouTube. Over to you, Kalyani sir, to give you a vote of thanks and conclude tonight's session.
Just 1 minute before Kalyani. Kalyani, I think really I am also overwhelmed that you are there, Vidyut, then everybody is there, Dr. Chatterjee, and even the prologue with his ill health, he is also here. I am really thankful to you people also. No thanks, but I think our unity, our same mentality to make homeopathy in a broader way, our motto, and hopefully the audience or the students, whoever speak or who are listening here, or every day my earnest appeal that to become a good homeopath, it's a lifelong journey. I know. I learned so many things from Dr. Kalyani, so many things from Dr. Adhikari, so many things from Dr. Abhijit Chatterjee, because I am a lifelong student. And still I am doing so many things. Later on I am realizing, most probably, if I have not taken this medicine, instead of would I have taken this medicine, most probably result will be would have been in a better way. It's a death, then birth, or what should I say? Success, failure, everything in our life. But at least we should do something that we are try our level best, for which at least from our knowingly we should not do anything wrong to our patient. If we really do, I think that should be a crime. And another thing I am telling, that at least with our this alumni association, at least we are coming to a bond for which this criticizing each other or degrading others' prescription, that should be stopped anyway to keep our homeopathy survive. Thank you all.
Thank you, sir. Over to you, Kalyani, sir. Sir, unmute করুন. Kalyani, sir, unmute করুন.
Now, am I audible now?
Yes, sir.
Audible.
আবার unmute করুন.
Sorry. Am I audible now?
Yes, sir.
Anyway, really, we are all are thankful to Dr. Sarkar, Dr. Obiji Chatterjee, and many thanks to Pralay Vidyut, all of you who are viewers and participants. So lastly, Dr. Sarkar's conclusion is beautiful. I heard it in my school life. The more you learn, the more you realize how little you know. So please go on study daily. I remember one thing. You might have heard the name of Dr. S.K. Dubey, who has an encyclopedia. The moment you ask any symptom, he will tell you the page number, paragraph number, line number. This was Dr. Dubey. He was basically gold medalist in anatomy. He was first teacher of anatomy to us. Then voluntarily he became teacher of homeopathy, living anatomy. And he became a gigantic figure in Mathematica. All of you might have been knowing. So after my teacher, I saw that person who could tell the page number, paragraph number, and line number of the books. I found my dearest brother, my best friend, Dr. Sunirmal Sarkar, who is maintaining that tradition. Book, paragraph, line, when it is available, where it is available. The more you practice, the more you see the cases, more you will get the test, and automatically the things will remember and you will make your own Mathematica. Everyone is, if you study the literatures of our gigantic figures, Cain, Bonninghausen, Hahnemann, everyone have got their identical or different type of approaches. All of them has contributed to homeopathy. So it is our responsibility, like Dr. Sarkar, to contribute something to our system, to enrich ourselves and to keep homeopathy by keeping its head up. Thank you all. Be present, come in the seminar with your contributions, please. Not only financial, mental support, and by showing us your successful case records, by which all of us will be encouraged. Thank you all. Many, many thanks to everybody. We'll meet again. Thank you very much and good night.
Back to our backstage editor. Orko.
Thank you all for watching this CME. I hope you have enjoyed. And to all those viewers who have asked questions, we are really sorry that we can't answer all of the questions. But as suggested by Dr. Vidyut Mukherjee, you can write your questions again on the comment section of this video. As soon as the video gets reprocessed by the YouTube, it just have to go to some processing. So after that, the video will be uploaded and you can ask over the comment section about what the question you want to ask. Also, do make sure to subscribe this channel for more CME sessions like this. We conduct many CME sessions and sometimes we highlight also a part for every CME or part which may be required in our in our NEET PG or something. So for that, like, we have a video on our channel about dissertation, and done by first video of Dr. Pritham Mehra ma'am, who was the third winner over here of this contest. And yes, we will have some contest in future and we'll make sure to update you on that. For that update, you just need to like our Facebook page to get those updates, and follow us on Instagram and Twitter. Also, we will post updates over there. And for further information about other CMEs which are going to be conducted on June, July, and other upcoming months, or maybe scheduled, will be updated on that pages only. So thank you all once again, and don't forget to mention everyone and share this video to all the other fellow homeopaths and also your medico students. So thank you again. Thanks a lot to all the sirs, respected sirs, who came tonight. And it's me, Orko Mukherjee, second year student from Bardhaman Homeopathic Medical College and Hospital, signing out.